Hello everyone, welcome back to our channel and we'll be discussing the important topic of biopharmaceutics and pharmacokinetics. So our today's topic is bioavailability. So bioavailability is defined as the rate and extent, the rate and extent to which a drug is absorbed from its dosage form and reaches systemic circulation. This definition does not include IV route drugs because they are directly injected into the circulation. So their bioavailability is considered 100%. So they are not included in this. But why bioavailability is important? A fast rate of absorption is helpful in acute conditions such as pain, fever, or asthmatic attack. Okay. On the other hand, a slow and steady, sustained absorption is better for long-term therapy. Any changes in bioavailability affects the drug pharmacological effect. So the bioavailability can be measured using plasma time curves. Okay, to measure the bioavailability, we use plasma drug level and time curves from which we get Cmax, maximum drug concentration, Tmax, time to reach Cmax, AUC, area under the curve, the extent of absorption. Let's talk about the bioequivalence. Bioequivalence means that two or more similar drug similar drug products have the same rate and extent of absorption when given in the same dose. For example, okay, for example, drug A and drug B are said to be bioequivalent if their plasma concentration versus time profile are nearly identical. You can see in the graph. According to regulatory standards, a 20% okay 20% variation in absorption is generally acceptable. So if two products are bioequivalent, you can safely substitute one for the other. This is especially important for generic drugs, okay, generic drugs which must prove they are bioequivalent to the branded version. Let's look why the bioequivalence studies are essential. If a new drug is developed to replace an existing one, equivalence must be proven. These studies ensures the new drug performs clinically just like the original one. For this, both the test and reference drugs must be pharmaceutical equivalent, same dose, same strength, same dosage form, as well as the same route of administration should be given. Bioequivalence study may include single dose or multiple dose. Okay, multiple dose depending upon the type of drug. Subject selection: usually a healthy male adults aged between 20 to 40 is selected, and selection of subject is based on medical history, physical examination, laboratory test. Exclusion criteria is also included, and restriction, prohibition, if there are any activity of subjects is recorded. Ethical aspects, basic principles we have to follow, and consent of the subject, that is participants, consent form we have to take, subject withdrawal we have to give the rights to the subject, and EDR and emergency procedures we have to be ready with how to manage, and in emergency case how we act. Okay, then facilities, we have what we are providing, analysis of data, analytical validation procedure, as well as statistical treatment of data. Then lastly we have the drug accountability. So there are some basic considerations when doing this bioavailability studies. These are divided into two: single dose studies or multiple dose studies. So how do we decide whether to conduct a single or multiple dose study in bioavailability? The answer depends on previous experimental data and the nature of the drug. Single dose studies, they are the most commonly used method, especially in acute management, like painkillers or antipyretic drugs. Merits of single dose studies are they are simple and easy to perform. Subjects are exposed to less drugs, reducing the risk. Then we have the demerits of single dose studies. They cannot estimate steady state, steady state drug levels. They require longer sampling period to capture the drug behavior. Now let's talk about the multiple dose studies. These are preferred when the drug is taken regularly. You need to study whenever you need to study the steady state behavior, these studies comes in. The key here is to achieve steady state, usually by giving the drug for 5 to 6 elimination half-life before sampling. Merits of multiple dose studies are these multiple dose studies are more relevant for chronic medications, and fewer blood samples are needed, and it predicts the drug peak accurately. It helps in detecting non-linearity in drug absorption, as well as it requires less subjects. Demerits includes these studies are time consuming and complex. These studies are more expensive, and higher drug exposure may cause the adverse effects. Patient compliance can be a challenge here. Let's talk about a key part of every bioavailability study, that is subject selection. The subject can either be a patient or a healthy volunteer. Depending on the drug and study type, we select these subjects. First, we'll talk about the patients. Patients are used here in whenever there is multiple dose studies, and when testing high risk drugs that can't be given to healthy people, we'll go with the patients. Advantages, that is merits of this patients are gives real clinical benefit, directly assesses the drug's efficacy, and avoids unnecessary exposure in healthy individual. Then demerits are it is hard to recruit a large patient group. Okay. Then other diseases may affect the bioavailability. The patient can have the other disease, so it will affect the bioavailability. It's unethical to draw too many blood samples from a sick patient. Next, we are taking the healthy volunteers. Most bioequivalence studies use healthy adult males, typically aged around 20 to 40 years and weighing between 60 to 90 kgs. Why not females? Because menstruation, pregnancy, lactation can alter the drug levels. Females are only included under strict conditions like using oral contraceptives to avoid fluctuations. Then before selection, the subjects are medically examined to exclude any undesirable abnormalities or diseases. Then we have the exclusion criteria. In exclusion criteria, we are seeing that history of drug abuse or smokers, then psychiatric illness. If they have any of these, we have to exclude them, as well as taking other drugs regularly and used OTC drugs within the last 7 days, so we will not include them in our study. And took any antibiotics within 1 month, also we have to exclude them. Women on contraceptives are also often excluded. Lastly, we have here is washout period. So what do you mean by washout period? It is the gap between two drug administrations in crossover studies. During this time, the subject is not allowed to take any medication. So this ensures that the first drug is fully eliminated from the body and prevents its carry-out effects. So that's all for today's video. If you found this helpful, hit the like button and share this video with your classmates and subscribe for more videos.